Let's send it over to Ray Strickland in downtown Baltimore. Ray, the governor says the tests purchased from South Korea could actually maybe help some of these wait times that a lot of folks have been seeing.
Yeah, Kelly, he says a new state lab at the University of Maryland, Baltimore is now processing thousands of tests, some of which, as you mentioned, were received from South Korea. Now, the governor says those turnaround times could be 24 to 48 hours, but it seems that's currently only for high priority patients. Others, at least for now, may have to wait a whole lot longer.
My wife and I were out at a rally over the weekend.
John Jason says he and his wife didn't have any symptoms, but wanted to get tested out of an abundance of caution. So last week, the two decided to go to this drive-through testing site in Glen Burnie. Jason says the process was easy, but the hard part has been the wait.
The disturbing part is that it's now almost exactly a week later, and we still don't have testing results. Really, the only thing that we have to go on right now is, well, at the moment, we're not showing symptoms.
High priority cases or people showing symptoms have been able to get their test results back as quick as 2 days. But across the country, people with no symptoms like Jason and his wife have had to wait 7 days or as long as 2 weeks. It's because the uptick in cases nationwide is leading to an increase in demand for testing. That combination is overwhelming commercial labs, creating a backlog.
We are concerned.
Governor Hogan says there's also been a shortage of tests because of demand. He says the state is ramping up its testing capacity. A new state lab at the University of Maryland, Baltimore is now processing thousands of them, some of which came from South Korea.
Unlike many of the commercial labs, which are experiencing these serious delays, we are able to turn around these highly sensitive Korean tests at our new lab, turn them around in 24 to 48 hours.
But that turnaround time is for high priority patients. Others could still wait longer for their results. Former Baltimore City Health Commissioner Dr. Lena Wynn says that's concerning and it could make it harder for states to control the virus.
It's essentially worthless if we find out in a week or in 2 weeks for the purposes of contact tracing, because by then it's too late to identify all those individuals that you could be exposed to during the time that you were infectious.
As for Jason, he's social distancing as much as he can as he waits for his results. But his concern is, what about the others who aren't?
That means somebody's walking around shedding virus and they don't know it until they start experiencing symptoms themselves. So that puts more people at risk.
Now, if necessary, I'm told that this state lab could start processing people who aren't considered high priority. That could give, of course, much needed relief to commercial labs. Now, meanwhile, Dr. Wynn and other public health experts are calling on the federal government to implement a national strategy on testing. They, too, hope that could speed up the process. Live in downtown Baltimore, Ray Strickland, WMAR 2 News.